This stage right here is we have a symptomatic patient who has had travel in the areas that are concerning.
Travel.
And they're symptomatic.
And what kind of symptoms?
We have fever, we are vomiting, severe abdominal pain, nausea that you would
So that's the
vomit.
full symptoms,
Diarrhea.
not just the fever, which is the first
Yeah, the
thing.
fever starts at the...
Well, you wouldn't wear one of those just for fever, though. If they
Depends on where
It
you're working.
depends when their exposure
Okay.
was and what their exposure
Yeah,
was.
and
this is a multi-person job to put this together. This is to make sure that we're safe. We're going to have 3 people doing this job.
The personal protective equipment you see here is the attire that would be worn when patients present to our emergency room, potentially high risk, who have been screened and are exhibiting symptoms of Ebola to the degree of potentially high risk exposure, and that is vomiting, diarrhea, any body secretions that our staff may potentially be exposed to. This personal protective equipment would be worn with patients who are low risk for exposures to occur. So healthcare workers and the general public, when patients present with possible travel outside the country and are in Africa in the high outbreak areas and exhibit with a fever but no other symptoms of the disease process, then the appropriate personal protective equipment is a gown, mask, and gloves, and that's what our healthcare providers will wear.